Recording from the Sunshine City, St. Petersburg, Florida, overlooking beautiful Tampa Bay, this is the Sonography Lounge, sponsored by Gulfcoast Ultrasound Institute. This podcast is dedicated to medical professionals and patients around the world interested in diagnostic and interventional ultrasound. Our podcast will discuss everything ultrasound, from news, trends, career paths, new technology, and industry updates. Hosted by Lori Green and Trisha Rio of Gulfcoast Ultrasound Institute, they bring over 4 decades of experience in the ultrasound profession and are here to guide you through this journey. Now sit back, relax, and enjoy.
Hey everyone, and thank you for joining us today on the Sonography Lounge, where we talk all things ultrasound. I'm Trisha Rio, and I'm joined with my co-host, Lori Green.
Hey everybody, happy to have you here.
All right, so we all know ultrasound is a versatile tool with increasing access and growing utilization, especially as a first-line imaging technique for many practice specialties. But as fast as ultrasound has expanded globally, AI-related technology has too expanded at an unprecedented rate in the healthcare industry because it excels at identifying complex patterns, can provide quantitative assessment automatically, and it results in a more accurate and reproducible result.
So in today's episode, we're going to focus on integrating AI in ultrasound, and we're happy to have with us today Luke Baldwin from Echonous join us.
Welcome,
Hello.
Luke.
Welcome.
Yeah, thanks for having me.
So, Luke, you've spent 15 years in point-of-care ultrasound managing the entire spectrum of marketing, from content creation to brand management to product management, both at Sonosite and Philips. And now you lead marketing and product management at Echonous as the Vice President of Global Marketing. So why don't you just start with a brief overview of Echonous and tell us a little bit about the company?
Yeah, sure. I think like you pointed out, I've been in ultrasound for a while, and I think what I love about the space is, as a marketer, as a, product leader, the goal is to solve problems or to introduce people to a solution to a problem that they have. And as a problem solver at heart, for me, the ultrasound space is just an amazing opportunity where you're solving problems that are actually helping people's lives. And so what's interesting about Echonous, and I joined after they were well on the way, had a product and all this stuff. But what was really interesting about joining Echonous is the problem that they're solving. We're solving it in a brand new way. We have the technology that we've developed is really defining a whole new category of point of care ultrasound. So historically, your legacy point of care ultrasound systems, your cart-based systems, are going to have all the features you need, but they're going to come at a price, and they're not going to be as portable as, let's say, handheld. And your traditional handheld systems these days, you're going to have, low cost, highly portable, but you often compromise on image quality or capabilities. And so what we've done is compressed all of those into one device where you have something in a handheld form factor, so ultimate portability at a handheld price point, but it has the capability set of your highest end point of care ultrasound systems, incorporating CW Doppler, PW, and then layering on top of that an incredible problem-solving technology called AI to make that very, very accessible to the newest users. And so, it's an incredibly exciting company to be a part of.
I would agree with that.
Yeah.
It's a good time to be in ultrasound.
Absolutely, It is.
Yeah.
And the portability and versatility and the capabilities of the system is really important, and everybody has a different need in the environment that they work in. So it's nice when you can have a system that is able to offer you the flexibility that you might need in different scenarios. So
Yeah, right.
and
So to be able to put it in your pocket.
Yeah. Exactly.
It's nice.
So you're right. This the point of care ultrasound market is very exciting, and it's really expanded the capability of being able to effectively treat patients in a more expedient manner, and that really helps to result in more positive patient outcomes. So it's exciting to be able to work with you and others just to, bring that technology to our medical professionals so that they're able to provide higher level of patient care. So,
absolutely.
yeah. So in terms of your system having AI, we wanted to kind of feature that in today's podcast. So why don't we start out with you just telling everybody about what is the point of AI and ultrasound? What's the benefit of that?
Yeah, I love this question. And I think, it's something in this era we need to be introspective about. I mean, AI is exploding. And so you have to ask yourself, what is the point? Is it just to sort of get on the bandwagon and just say, hey, we have AI too? Is it just a sneaky way to make extra money? What is AI? What is the point of it? And it really, for us, it goes back to problem solving. AI is a tool, just like our computers or the internet or the wheels on your car. They're a means to a bigger, a more important end, so that it's not an end in itself. So for us, as we really reflect on what our vision is as a company, I've been struck, in every company I've been in, we have these conversations where we'll sit around as an internal team and we'll think about the product, we'll think about our users, you think about the various physicians and clinicians around the world. We think about ultrasound and what's the point of ultrasound, and often these conversations go back to a time where one of us will recount an experience we had at a hospital where a loved one was seen by a doctor and they didn't have ultrasound or they didn't use ultrasound. I remember one time we were in the hospital, my son had extreme abdominal pain, and I'd been in ultrasound for years. I'm like, all right, guys, where's the ultrasound? Why aren't you using
Yeah.
go look inside, and I pointed out they had I think it was an M Turbo or something down the hall, and I said, hey, can you just take a look? And they're like, oh, the person who uses that isn't here on shift. And it was this moment of like this gap of you know about this great tool that can give you so much information dynamically in real time, safely with no radiation. And that it's there and it's not being used. And so we sort of distilled that idea into like this vision for us is, can we help to create a world where no one has to say, I wish my doctor would have used ultrasound. And it just kind of creates that I guess a connection to our physicians, but also to their customers, the patients. And so how do you do that, right? So the question is about AI. What's the point? The point for us is how can we lower that barrier to ultrasound adoption? And there's a number of reasons why people don't use it. But the number one reason is education. That's in every study I've seen, every survey I've seen. The thing that prevents someone from using ultrasound or delays them from kind of crossing that threshold is, I don't know how to use it, or I don't know how to use it well.
Right.
And so you break that down. You say, okay, education's a big barrier to ultrasound adoption. That's why my son wasn't seen. They didn't use it on my son in the hospital. So what is that made up of? And, we think about it in three different ways. The first part is, how do you use the ultrasound system? What do the buttons mean? What is the transducer? All of that. And then it's, how do you get the right image? How do you look at the image that, what window, how do you know what you're seeing on the screen? And then the last part is interpretation. Is that a normal heart? Is that an abnormal heart? Is that the bowels I'm seeing? Is that something else? And so we look at, there's a lot of ways in the industry you can help overcome that barrier. You could just, muscle up and provide a whole bunch of education. And some companies have done that. You can make your system really easy to use. that should be table stakes at this point. Ultrasound systems should be easy to use, but what else can you do? And that's where AI comes in for us. That's one of the big reasons we use AI as a problem-solving technology, is to help novice users become more proficient. And so with the technology that we've used, someone can, put the probe on the heart if they want to look at a parasternal long axis. You put the probe on the skin, and now it immediately starts telling you where to place the probe to get that window, and then how to optimize the image. So it'll tell you, guide you and where to put the probe, and then it'll grade your image and tell you that's a good image, that's diagnostic quality, or that's not diagnostic quality. And so you can kind of hone in on what a good image is. And then also at the same time, it's telling you what the anatomy is. It's labeling it. So for a new user who's trying to orient themselves to think of the image as a slice, a two-dimensional slice of the anatomy, it helps them to orient. Okay, I've seen this in a book. Okay, that's the right ventricle. That's the left ventricle. So it helps with that second step.
Right.
It doesn't help with interpretation, but it helps them to become more proficient, to know if I know I want to look at the valve, I want to look at this valve in this view of the heart. How do I get there? The system will help to overcome that barrier. And so, several of us at the company who are not clinical have trained ourselves with this very same AI. I know exactly where my parasternal long axis window is now by muscle memory. I don't need the AI to help guide me. So I think that's one key way that we employ AI, and the reason we do that is to really help new users to become more proficient. And I think the other big barrier that we can help with AI is allowing expert users to be more efficient.
Right.
So there's a lot on a system, on any given system. You go back 10, 15 years ago, and there was, every capability of the system was visualized as a button on the interface. Now with touch screens, you don't have to visualize everything, but then what do you do with those buttons? How do they find that functionality? And with AI, as long as the machine knows what the user is trying to do, it can take away a number of those steps, a number of those reasons why someone might have to interact with the system. So like an ejection fraction is a great example where, you decide you want to do an ejection fraction. It'll guide you to get the apical 4 chamber. It'll capture that image automatically. It'll guide you to the apical 2 chamber. It'll capture that automatically and then run the report. So as far as button pushes, you push auto EF, and that's virtually it from there on out until you're done. So the impact there in terms of efficiency is you go from a 2 to 3 minute exam on a legacy cart system down to less than 20 seconds. And again, it's not AI for the sake of AI. It's I don't pick up an ultrasound system as a clinician to do an ultrasound. I pick up an ultrasound system to answer a question.
Yeah,
and so if we can help them get to the question faster with this tool, then that impacts patient care in a pretty profound way.
Yeah, especially when it's urgent care. So you guys are awesome. You support our programs by providing systems. We've had the pleasure of working with several of your systems and watched the development over the last 3 years, I would say, 3 to 4 years of the AI technology, and constantly updating us and our systems to make sure that we have the latest and greatest. And I have to say, using it in a education aspect, it's incredible to see how it really helps with the confidence. And so you have somebody who's scanning and they're looking at an abdomen or they're looking at the heart and they're not really sure of the anatomy that they're seeing on the image. And then all of a sudden it just pops up and auto labels and they're like, oh, wow. And then you just see, oh, okay. And then it really helps to start build that confidence. And by the time I'm working with them the following day on maybe a different system, I just see the level of confidence that has increased, both from obviously the hands-on skills training, but also because of the ability to have that system there kind of walking them through that scan and providing them that feedback without me having to constantly be pointing to structures and telling them. They're just looking at the screen and interpreting what they're seeing. And it's just, It seems very just natural for them. And so I definitely have seen that as a useful tool in education as well. So
that's cool. I mean, that's great to hear. We're not always able to be in the room in those situations, and we hear it anecdotally, but it's so validating to hear that feedback. I mean, it's certainly been our experience, and I think some of it's being proven out too, and some recent research that's come out this year. Institution-led stuff. So at Stanford, Andre Kumar did a really interesting study comparing a group of new users. They had a non-AI system, didn't provide any guidance, didn't provide any instruction, and then they had an AI group, they were using the Kosmos product, and the numbers were striking in terms of image quality scores were higher in the AI group. Time to acquisition was faster. They were more accurate in diagnosing the diastolic dysfunction. I forget the word, but the diagnosis
sounds right.
was more accurate as well. And the only difference was they had the same training. All new users. The only difference was AI. So. And those are the types of things that start to count. Can they get the image quicker? Can they get a better quality image? That's where, again, they're using the technology to answer a question. If that question is answered quicker, if it's answered more accurately, these things really matter in healthcare. So that's why we're in the AI game for sure.
Especially even in markets too, like we were talking earlier about EMS in pre-hospital, but also in family practice. These family practitioners have only several minutes dedicated to each patient and stuff. And when I think a big misconception is that you're going to spend more time with ultrasound when in fact you'll actually get your patients in and out faster, especially utilizing technology like this, that you can get them out the same day with answers and the next steps in that diagnosis.
And I always tie that back to reimbursement, because patient satisfaction scores are a huge part of reimbursement. And think about how much happy you are when your physician put the probe down on you, talked to you about what was on the screen, what they're seeing, said, I don't need to order a CAT scan because I see this. Our next step is this. And I just think about what that does for patient satisfaction, not only outcomes, but satisfaction. Because at the end of the day, everybody knows in healthcare we have to make money. So having higher patient satisfaction means higher reimbursement.
Yeah, and you think too, there's the time of the exam, and you do hear this a lot. I don't have, I've got 3,000 patients. I have 15 minutes with each one. I don't want to be fooling around with an ultrasound system, and there's that per exam time that people are afraid of taking too much of that, and can I be proficient enough? And the other thing that is interesting, you mentioned patient satisfaction. I mean, being able to get the answer right then and there is enormously satisfying for patients, and it's as well for the physicians. Once they get to that point, it's like, hey, I can get to that treatment plan way sooner, or I can have confidence, again, back to the confidence piece, in whether or not, if this person comes in and they're a little short of breath, and there's and I suspect something's going on with the heart, and you take a look and you run an EF and you get a couple calculations to decide, hey, yes, for sure, we want to get a full echo. Their EF's a little low, or no, or their heart's totally fine. We don't have to order a full echo, because that could mean weeks before you could get in for that full echo appointment. And then you've got to wait for the results, and then you've got to make another appointment with your doctor. But if you can shortcut that as a family practice practitioner, it saves your patients so much extra time and so much extra money. and it saves the system as well. I mean, there's only there's a set number of cardiac sonographers. I heard recently the number one reason that a full echo is ordered is to get an ejection fraction. So if you could, there are patients who really need that full echo. And if you can keep people out that don't, that also helps the whole system and helps other, patients who really need that more advanced exam to make sure that they have a spot. So there's a lot of these things that are kind of tied together.
Yeah, absolutely. Well, just bedside ultrasound in general, with or without AI, I mean, the benefits of that are so far-reaching and can be life-saving at times. And so utilizing that, if you have a system that has AI, then, that can augment your learning curve and help you to feel a little bit more confident and have your confidence to where you're willing to actually integrate that into clinical practice on a more frequent basis than just here and there. And if you're only doing it every once in a while, then, like anything, practice makes perfect. So, but like Trisha said, in our education environment as well, it definitely augments the educational experience as well, because that's just reinforcing to the learner what they've had taught to them in their didactic and their other scanning skill set, sessions. And if they have a system with AI, when they go back home, the fear level is a little less because they know they're going to have that capability to help them to reinforce that this is the appropriate anatomy. I am getting the appropriate view and so forth. So, and to help with some of the measurements that can be a little bit, daunting to some people.
Agreed.
So it is a nice, definitely a benefit to having that.
Yeah, it's something I hear about a lot. I'm curious to, hear your thoughts on this in the being educators. But you hear a lot. The process to learning ultrasound it's obviously it's a user dependent technology. So you have to know those three things: how to use the system, know what you're looking at, and then know how to interpret it as well. But a lot of these clinicians are on the job, and so learning on the job is tough. Yep. And so, they might go to a weekend workshop or a course or something like that. They go back into their practice, and there's this moment of crap.
That's exactly what it sounds like.
Is this something that you hear a lot about?
Well, especially from the very the very new first time they ever held a transducer in their hand, there's fear in their heart for sure, but if they are able to devote a couple days to at least getting the core basics, to go back, we call it the friends and family plan. The more you scan, the better you get, and if you have a system that has some extra benefits to help you be more comfortable in what you're seeing and what's normal and what's not normal, and is that an appropriate view, and that sort of thing is definitely going to help them to accelerate their learning curve to where they do feel pretty comfortable just utilizing it every day. And most of the time what we hear is, I don't know how I've gotten along without this for so long. Now that I know, I can go back and I can start scanning and utilizing it for this, that, and the other. And then once I've done that, I'm now using it for other things, and it just starts, the utilization of it just starts growing exponentially because they see the value. They, like Trisha
We
said,
become almost obsessed with it. Like, you're like, I can do this now. Now I want to try that. Well, do you think I could learn how to do this? And it just turns into this snowball. And I think they just organically start using it more and more and more.
Right. We've seen that, and we were one of the first to offer emergency ultrasound courses starting back in 1994. And that market, and that now we're seeing the utilization growing exponentially in family medicine. And they're kind of where emergency medicine was, 20 years ago. But they're rapidly adopting the use of ultrasound, and residency programs are incorporating it. And so the awareness is there, and they want to use it. But again, there's that level of hesitancy because they don't know how to use it. They, they aren't even really familiar with what's available to them. You know, they just know I need a handheld system.
Right.
You know, so Casey and I were just at the AFP meeting in October, and there was great interest there. But it was the same thing over. I need the education. I don't even know where to start. I know I need a handheld. You know, all those questions come out, and so
I didn't know. I don't think that I can get reimbursed for this.
right,
that's a big one.
That was a big.
That was
one.
I mean, at AFP for that to hear that was pretty interesting. But and especially it's interesting seeing the trickle down effect now too, because you know, like Lori said, in the emergency medicine setting and critical care, they've been utilizing it now for a couple decades, and everybody's kind of getting familiar with it. And when we go and exhibit at ACEP, it's people coming up saying, I can't thank you enough for this education. Like, it's literally like shaped and changed my careers. Well, now they know, and they're so comfortable with ultrasound, they're expecting it before people are even transported to the hospital. And so it's kind of trickling down to EMS and pre-hospital, and how are the technologies communicating from in-field to be able to get those images ahead of time, or have your in-field operators like transmit that data. So it's interesting seeing that progression of things. And then same thing with family practice. Like, you know, there's a lot of practitioners that are dual boarded, and they're working emergency medicine and family practice, and now they're expecting their other providers, you know, nurse practitioners, PAs and stuff, to be able to be at the same level as them to provide the same sort of diagnostic and treatment capabilities.
Yeah. And just to take it back to the question, we just recently had a point of care scan workshop, and we had a participant in who had never held a transducer in her career. She was family medicine, you know, dual certified, where she also does emergency medicine. She's in a very rural location. And when she came in the door, she was very hesitant, very shy. She didn't want to be the first one to scan. You know, just, I've never done this before. She kept apologizing for taking, you know, a long time to get an image, or to, you know, figure out the orientation of her probe, and having to correct her a lot and correct her hand placement and things. And then by the end of day one, I started to see the change, you know, and that's what's the benefit of a hands-on class. You come in and you have expert instructors who are guiding you and helping you with your hand placement, and how do I, when gas is in the way, how do I get around that? You know, we can have all the AI we want, but at the end of the day, you have to know technique, and there's a technique to it. And but I could see it building in her. And then by the time day two started, she was like, oh, I want to scan first. And I said, well, look at you. Things have changed. And by the time she left at the end of day two, 12 hours of hands-on scanning, she said, I cannot believe how much I've learned in 2 days. I cannot believe how confident I feel to go back and integrate this. But she did say, I'm thankful we have the system we have, because it does have certain she didn't say AI, but it was AI, certain technical aspects to it that will provide me some feedback, guide me, will do these auto calculations for me. And I look forward to scanning on it, because I know that I'll have that to kind of supplement and reinforce what I've learned here. So it was really cool to see that progression in her over the course of the 12 hours she was with us.
It's amazing how important confidence is in the equation, you know. And I don't practice medicine, obviously, but I've experienced the confidence barrier in my own profession. So, you know, we'll go to conventions, we'll go to trade shows, we'll talk to physicians all day long who've been scanning for a long time, and I've always been nervous to scan myself in front of a physician, because you know, they see this stuff. What if I, you know, can't find the window? What if I can't, you know, don't represent the technology well, or this or that? So I always, you know, opt not to, until I started working here. So it's 15 years. You'd think I'd get really good at something, right? But I was still nervous. So I started using our Trio feature. And, you know, an apical or a parasternal long axis is pretty easy to get to, just to unbutton your shirt. And so I'm like, well, I'm going to try to see how well it works. And honest to goodness, 5 minutes later, I'm getting diagnostic quality according to the rating. And, you know, that took care of this confidence thing for me, because I knew I had something there to tell me what to do. And if I got into trouble, if I got way off, I could at least get back to ground zero and start optimizing again. And so at that point, you know, I don't hesitate at all. I'm almost like, hey, you want to see it? And they're like, no, it's fine. It's fine.
It is very
You know,
accurate too. I can say that.
Yeah, it is.
Yeah.
What a great way to
so
demonstrate.
Yeah.
yeah, and it's one of those like, you know, and now I don't need the AI because I mean, I have the advantage, I'm scanning myself, so I can feel exactly which rib and exactly which angle. I have that muscle memory, so I don't need it anymore, so I can turn that off. And I imagine, you know, obviously I'm not, you know, interpreting or, you know, anything like that. Every patient's a little different, but it's just a little peek into that experience of I don't want to scan because I don't know what I'm doing and I want to look like a fool, to I know what I'm doing, you know. And just that transition was just me and the ultrasound system and 10 minutes of work, and now I can't go back, right? It's you know, it's not like I'm going to forget. With muscle memory, it's pretty long lasting. So it's interesting to see that confidence piece can really prevent someone from taking that step, you know, whether they're there with a patient or at a workshop or whatever. It gets to give them a little bit of confidence to just try it. It builds from there.
Yeah, for sure.
You know, like you were saying.
Yeah.
Well, you mentioned, you know, when you were just speaking, the trio. So why don't we transition, and why don't you tell us a little bit about the AI capabilities that are on the Kosmos?
Yeah, sure. There's a few different flavors that we have, and again, you know, we say AI and as if it's like this magical thing. It's, you know, there's no magic involved. It's, you know, I like how your student described it. You know, it's a like technical assistance or, you know, whatever.
Yeah.
But yeah, there's a few different flavors that we employ. One is really directed at helping new ultrasound users or novice scanners to become more proficient. And so it's really dedicated toward helping them to know how to do a particular exam or how to capture a particular image. And so so one of them is Trio, and it's Trio because it's doing three things kind of simultaneously. So it's there's a little animation in the window, and it shows a depiction of a body and a transducer on there, and it shows you how to move it, where to place it, you know, relative to the body that you see in the animation. So, you know, tilt, fan, slide, to kind of get you to the right window. And then at the same time, it has these 5 bars. The more bars, the better. So if you're at 1 or 2 bars, the bars are colored red to say you're not there yet. And then once you get to 3 bars, they turn green. 4 bars and 5 bars are, you know, perfect. If you can get to 5 bars, you're doing great. So it's just kind of like it's fun to watch people use it because they're like, come on, I'm at 4 bars, and you know, they're trying to what those fine little movements. They're seeing how every little thing impacts the image quality. And then the third thing it's doing is labeling the anatomy in real time as well. So in this case, you're looking at the heart. We have 3 views for Trio: parasternal 1, apical 4, and apical 2. And so it'll label all the anatomy of the heart in real time. It'll show you what the valves are and the chambers. And then we have, I guess, still thinking of on the education side, we have what we call the Fast AI. And that one is for any part of the FAST exam that you would normally do. We have labeling of the anatomy there. So the abdomen, and then it'll label the view that you're in: right upper quadrant, left upper quadrant, etc. IVC, it'll label all that anatomy. It won't label whether or not there's fluid in the abdomen, but it'll label the space where fluid may accumulate. So that's Fast AI. Then we have a few others. So the Auto EF is driven by AI as well. So it incorporates Trio, And then it's taking you through the biplane Simpsons method, which is, the gold standard for EF. So it guides you to get the apical 4 chamber, then the apical 2 chamber. It'll auto capture those once you get the quality that the diagnostic quality that we need. And then it'll run that report, and it'll give you an ejection fraction, and then it'll show you the in that report window, it'll show you the images that were captured. You can tap into that and then adjust the tracing if you like, and then it'll recalculate based on those adjustments. So the control is really all in your hands as a user. And that one's really aimed at, there's an educational element for sure, but that is definitely aimed at improving the efficiency of that exam. Again, thinking of people that don't have a lot of time, and you want to answer a question about the heart. That's a very, very quick way to do that, and to have that confidence, again, to kind of guide you to make sure you're getting the quality that you need and the right view. And then we have some, various other ways that we employ AI for, if you're doing a PW or CW tracing the waveform, we use AI to assist with that for a VTI. And there's a lot more coming. So, yeah.
It's exciting.
Well, the efficiency aspect of it definitely speaks to even the more experienced sonographer or sonologist that's performing the exams, because we do hear from some of our sonographers about their fear of AI taking their job away from them, and so, you have to try to educate the sonographers as well as to how that's going to benefit them, help their workflow, help them be more efficient, as far as quantitation goes, especially in cardiac ultrasound. Those little things can make a difference in how long it takes you to get that exam done. So, I think that's something that really needs to be expressed as well, to not just the novice benefits from it, but the more experienced as well.
Yeah, it'll definitely improve workflow and efficiency even amongst the sonographers, and I feel like it'll also help with those interpretations from the radiology side of things. The radiologist or the cardiologist who's looking at that study has additional information, provided thanks to the AI, those calculations and things that were done. It's just more information. I think anytime you're dealing with imaging and making medical decisions based on imaging, more is better. Having something that's auto-grading your image and telling you, yes, this is a truly diagnostic image. It can never be a bad thing. You might not like the feedback.
Right.
That's fair, but it's honest, and it's going to tell you, this is a great image to perform this calculation. And if you don't have it, you don't have it. And sometimes there's not anything you can do, but then you have the AI to support you when you go to your cardiologist or radiologist and say, I'm sorry, I can't, because it's just not a diagnostic exam. Even the AI said so.
Right.
See, the AI tells it.
There's always a learning curve in everything that you do, and there's no perfect answer, but if you have some extra tools in your toolkit to help you out, that can definitely help you to expedite your learning curve, as well as help in your confidence building and also in the accuracy of your exam. So I think it's a great thing.
Yeah.
But as we said, AI isn't everything. It doesn't solve every single problem. So why don't you talk to us a little bit about that as well?
Yeah, it's like a hammer is great for putting in a nail, but it's not great for pulling out a screw or, putting a window in a house or something like that. So it's good for some things. It's not good for everything. And so I think that's where, as a company, we like to think of the picture in a more holistic way. And I think as we're thinking about, that's one of the reasons why we've also put more capabilities into this system than what you might expect in a handheld. That's why we spent extra time optimizing the image to ensure that it's the highest possible quality that physics would allow us to create, right? So we use, the gold standard technology that's proven. The piezoelectric crystals are the best in terms of image quality. And our heritage goes way back also. I mean, we're not this company didn't just come out of nowhere. Our heritage goes back. We have engineers from developing the technology that Philips uses from ATL. We have engineers from Sonosite. We have engineers from Siemens. It's ASIC-based technology, which again is gold standard for ultrasound. So all of those things have to work as well. And it's
Right.
drop tested, it's shocked, it's baked, it's frozen, it's, highly durable. So that's why we, warranty the product for 5 years. But the capabilities, it's important to, I think the industry over the years has sort of developed technology that fits into boxes. We're humans, we like to categorize things. And so the handheld products have a particular set of capabilities. Your kind of mid-range products have a certain set of capabilities, and your high-end products have another set. And some of that just has happened, as manufacturers want to have a lower cost option, a mid cost option, a high. And so the way you differentiate products is by their capabilities. So there are some, your bigger companies that have products in each of those three categories. They're going to keep the handheld low cost products stripped down in terms of their capabilities, and they're going to unleash all of the capabilities possible in the high end systems, and there will be a premium for that. We don't have a product in every category, and so our thought is, why would we defeature this product? Why would we hold it back when it could be so much more? And so, that's why we're the only handheld device that has a CW Doppler, which is essential if you're going to do a full echo, which you can do, with our system. And then, so the capabilities on the product's really important. It just helps you to answer more questions. And so being something that has, capabilities of the highest end systems, but is also has the, some tools to make it very accessible for new learners. It's something that you can get while you're starting out, while you're learning. It's at a price point that you can afford in those early days before you're really able to justify the reimbursement and things like that. But it's something you can grow into. You don't have to graduate to some other $100,000 system. What you bought, now is something you'll be able to use as an expert in the future. And then, the other thing that we've done, to solve some of these problems with the handheld, a lot of institutions, they sort of put up with the handheld paradigm where I get the probe from the company, and then I got to go find out what tablet to use, and then I got to go find out a stand that will sort of hold this stuff together, so the tablet doesn't walk off, and so the probe has a home.
Right.
So one of the things we've done as well to solve that is we've put all those things together. We call it Kosmos Plus, and you get our transducers. We include a 13-inch iPad Pro and our own custom medical grade stand. You can plug in both transducers at the same time. You can plug the whole system into the wall and charge while you're scanning. So it has all of the same, all of the things you would expect out of, a premium cart-based system, but you don't have to pay a premium for it. So some of these things are also, they're barriers to adoption that, hey, as a company, as a problem-solving, entity, we can combine combine those things and make it so that much easier. They do one order, it all comes in the box, put it all together once, and we take off those extra steps for the end user.
Yeah, the cart is really nice. We've worked with a number of different machines, and I have to say the Kosmos cart is a game changer because it holds your tablet for you. You have a place to rest your transducers, and it's just, and you can plug both of them in, like you said, and just toggle between the torso and the linear, the Lexa. You just hit the button and it goes right back and forth between the two. So it's definitely a game changer, because there are times we're working with some other handheld systems and it's like, okay, I need a tablet. Well, now I need, like you said, the stand for the tablet. Well, I need the charger for the tablet, and I need, and then before you know, you've got all these things. Poor Casey, he's always wanted us to put all this together for us. We're like, Casey, I need it to cast to a TV. I need it to do this. He's just like, oh my gosh.
Well, and practically too, I mean, if you're, in a clinical practice, if you're going to pull that into an ICU with, patients that are, in critical condition,
Right.
All of those extra cables are they're a lot of times they're neglected in terms of cleaning, and disinfection. So the more things you have to sort of keep track of, the more things you also have to disinfect.
That's true.
And so if streamlining, there's the simple act of just streamlining it to where you've got
we
one
have.
thing
Can I pull
in.
this over
Yeah.
for our listeners? We have the cart behind me. Let's pull it right in to our view.
So while she's pulling it over, I know that like your original ones were Android based. We now have the iOS based one. Do users still have the ability to get an Android based if their facility require that? All right, good.
Yeah. We're Android and iOS compatible for off-the-shelf devices. And then, those are expensive devices. So one of the things you'll see there is that the stand head, it locks the tablet into place, and then there's a key in the back. So
I
if you're
don't know if I can show
a more
that.
volatile institution where
There we
things
go.
like to walk away,
Yeah. So there's the key.
you can lock that thing in place as well.
Yeah.
I think that's really important. It's nice that you kind of outlined those different features of your system, because especially for our novice listeners who are just getting into utilizing ultrasound or thinking about using ultrasound, they're kind of just going around asking some general questions, and many people just feel like, I just need a handheld. That's all I need. But they don't really understand how it all fits together, and they need to really think about what kind of environment am I going to be working in, what type of patient exams am I going to be performing, and there are a variety of handheld systems that are out there. There's not just one, which a lot of times people think there's only one XYZ system or whatever, and they don't realize, they don't know enough about it to make an informed decision on that initial purchase. And that initial purchase may make a difference as to whether they continue to use ultrasound and benefit their patients if they didn't make the right choice. So, there is that's good points that you made.
Yeah, there's a lot that goes into it that, especially as new users that, they don't think about, like you said, this just came up the other day. Our probe doesn't have a battery in the probe. And so it gets all the power it needs from the tablet that is plugged into. You might not think much about that until you pick up the system. You've got a charged tablet, you plug in the probe, and the probe isn't charged. So just having one less battery to think about is another one of those things. The wireless is a great solution, but that means you've got to have two devices that have to remain charged.
Right.
And so, they're just some of those basic things you might get in at a really low cost, startup cost, but then what's the service like, So that's where something you can rely on for 5 years versus something that might not, be as serviceable 2 years down the road when something goes wrong. Those are all things to think about.
Well, funny story. We had somebody here at the point of care class, and they brought their handheld device, and he made it a point to say, I literally told my administration I wanted a transducer I could put in my pocket. And then he holds it up, and the transducer is small, but it's attached to this giant Apple iPad Pro. And he's like, I can't put this in my pocket. And I was like, yeah, but you can put it on your phone. You can do it all sorts. And he's like, I can? You can use different platforms. You don't have to use this giant tablet. But I just thought it was funny that the people who are making the decisions a lot of the times don't have all of this information, which is why we do this podcast. Our podcast is for all listeners, not just clinicians. So hopefully there's some administrators out there who are looking for some solutions who are listening to this. And, they don't know the ins and outs of these things. They don't understand what they just did for that, or didn't do for that clinician by buying that very expensive iPad Pro. That was really nice, but definitely won't fit in his pocket.
Most of the time, purchasing departments don't have the medical background or even the understanding as to what is really needed, and they don't even know the questions to ask. But it's that's again comes back to kind of get what you get, unless you really know what to ask for and how it's going to best meet your needs.
Well, and that's why we do what we do by having
Exactly.
companies like yours support our programs. You get to put this into practice, and they get to come here and learn. And not only are they learning about integrating ultrasound, but they're learning about the systems that they're working on. And how will this meet my needs? And they get to see it and hold it and scan with it and really start to understand it in a different way and go home feeling more informed to make a decision that will hopefully lead to them integrating it full time.
Yeah.
And why we do these podcasts, so that we can reach more people and help to inform our listeners so that they can make appropriate decisions that can impact them for a lot of years. I mean, you only have so much money, right? You can't keep going back and asking for more money.
That's true.
So right away, right?
Right.
So, yeah.
Well, did you have something to add, Casey?
No, I was just saying that, just like you were talking about the capabilities of being able to scan and charge at the same time. So, facilities that have high volume, handhelds are great and stuff, but, you have to look at what you're realistically going to be scanning on a day-to-day basis. So, having this cart and stuff has definitely helped us in an education setting for sure.
Yeah. We do hear about that a lot. I think there is, like you said, your one of your students came in and said, I need a handheld. But it's interesting because there are no shortage of options these days.
Right.
It wasn't always the case. But there's ultrasound systems in every category, and they all emit sound waves, and they all produce a 2D image. And, so are they all equal? Well, it depends on your needs, right? And so that's where a lot of people are, the tough part about creating a new category is we're fighting against perception of, well, it's handheld, therefore it's limited, like every other handheld, or just for instance, the capabilities, you put that on a stand, you got both transducers, you've got the two transducer ability to connect them both at the same time. You've got this massive, 13-inch imaging screen on one of the, most state-of-the-art displays on the market, and you're getting that at a quarter of the price of a comparable POCUS cart system. And that's another thing that a lot of people don't know, administrators aren't aware of yet, is just how, I could buy we just had this happen recently where an institution was going to be buying several cart-based systems, and they found out about our product, and they thought, I could save 3/4 of the price, get all the same functionality, all the same transducers, and I get AI on a stand for a quarter of the price of what I was going to pay for these other systems. And so I think that's where, again, we're not beholden to a particular class just for the sake of it. We're in the business of solving problems, and if we can do that at a lower price point for someone who's looking at a high-end cart system, or if we can give someone who needs the portability of a handheld the ability to use it in that use case, or to marry it to a stand and use it as you would some other cart system. So it really can kind of play that whole spectrum, which we think is a big advantage, that people don't have to say, well, I can only do these exams with this product. Then if I want to do anything else, then I've got to go find a different product. And sometimes that's happening with the same patient. And so if they can go from A to Z without, on one system, we're hearing that's a big advantage that customers are appreciating.
And when you're when somebody's looking at systems and stuff, one of the questions that does come up too is this a, do they purchase the equipment and then they have to have a license to maintain it to keep working it, or is it a subscription, or is it a single pay purchase? How's that
Good
look?
question. Yeah, I mean, whatever option works best for you, we have that option. Most people go outright. They buy the probe outright and the software outright, and they don't have anything else to worry about. If that price point's a little too high, we do have options for subscription, or if you want to defeature the product and just do kind of 2D color PW, we have that option. So the software capabilities are a la carte if you wish. AI capabilities are a la carte. So yeah, there's awesome. But there's no need for any ongoing software. There's no account required to use it. It's once you have the product, you've got it for the life of the product.
Excellent.
Yeah.
Great to know.
That's great.
Well, building on that, can you talk to us and our listeners about the integration into the customer workflow? So I purchased this product. What comes next?
Yeah, as far as like how are people using it, or what?
Yeah, like how are they how do they basically go from the sale to the application? What do you guys do to support the customer in that transition? Just kind of like summarize it.
Yeah, with any purchase, there's an in-service. So we're happy to meet virtually for any questions, but we typically will be there on site to help put everything together and make sure that we answer any questions, or we can point out where the settings are if you want to integrate with your PAC system.
Perfect.
How to set up the DICOM destinations and things like that are often a question. How does that work? So yeah, I mean, we're very hands-on in that way. We're a U.S. based company, so we are global though. So we're in 74 different countries. Many of the countries outside of the U.S. are distributor-based or partner-based.
Mm-hmm.
And so there are some differences in terms of exactly how hands-on we as a team are. But usually those partners are very hands-on in the same way. We have a pretty high standard there. So yeah, and once you get the system, it's just as simple as downloading the app from the App Store, plugging in the transducer, and start scanning. I think that initial scan, you'll need to register the probe, so you'll need to be connected to the internet, and then that'll just check with the licensing server and just make sure that all of your licenses are activated.
Yeah, and obviously we're huge proponents of hands-on skills training.
Mm-hmm.
Come to a course, work with the experts, get that confidence. But you guys have a lot of tutorials built in too, don't you?
We have, yeah. So we have some tutorials on the system. There's a little video library on kind of getting started, but we really do lean on our education partners like yourself. I think we are very quick to say we're not going to try to be the experts in training how to do the ultrasound exams, and we point to your organization, which comes very highly recommended, and we get a lot of great feedback for anyone that attends your courses. But yeah, we point on our website. We're quick to say, if you need ongoing training, on-site, online, you guys have a ton of resources. So we always highly recommend your Gulfcoast.
Well, thank you very
Appreciate
much.
that. I know that
appreciate
comes up a lot. Like, people don't typically understand, like, well, if I'm paying this much, why doesn't the education company have accredited education? Well, that's beyond your control. It's beyond our control. That's the government's control and the AMA's control.
Yeah.
So they
keep it separate for a reason.
Equipment companies can't handle accredited education. We can't handle equipment sales. We maintain agnostic points of view and stuff, and we're there to help learners how to actually perform the ultrasound. You're there to provide the newest, latest, greatest technology.
Right.
And that's why these partnerships work really well.
That's right.
Right.
I don't think anybody could do it all perfectly.
No.
It's just a better outcome for the clinician and the learner to have it be this way. because this is what we do. We educate, we train, that's what we focus on. And you guys do what you do, which is make incredible technology that makes it easier to use and more efficient.
Right.
So,
Yeah.
Yeah, absolutely. Yeah, we couldn't do it without you guys. I mean, it's there's you know, we could raise money and create an education department and create this powerful stuff, but why? I mean, you guys are great at what you do. You're dedicated to it, like you pointed out. It's such a huge value that someone who needs to learn how to use ultrasound learns from people who all they do is teach people how to use ultrasound.
Right.
I mean, we've seen it time and time again at other companies and stuff for the past 4 decades. They build an education department, pump millions of dollars and time and new employees and stuff into it, and then they realize it's not our wheelhouse. Like, let's pull back and then come back to us. So we're
yeah, right.
Yeah.
the resources can be better utilized.
We're pretty big on. I mean, even we're not a big ego company, I guess. We very quick to partner with people that are better at doing something than we are. So I think that's like 19 Labs is a good example of that as a partner, where they have a whole telemedicine platform. Well, let's just integrate with that rather than trying to build our own and incorporate it and build out a whole team and technology and spend millions of dollars. But shoot, we've got an API, we have a whole software development kit, we can partner, and then boom. I mean, they were extremely quick on that. And so, same with education. It just doesn't make sense for us to try to reinvent the wheel when folks like you are constantly innovating, constantly, refining your craft and meeting users where they're at. I mean, there's no way we could catch up at this point, and it'd be a wasted effort, I think, in my opinion. And I think I don't mean to shame any companies who are putting out educational content and whatnot. I think that's totally fine. And for us, I'd rather underpin your efforts and send customers your way. It's going to be a better use of their money, and it allows us to really stay focused on what we're good at. We're staffed to redefine ultrasound, redefine point of care ultrasound. We're not staffed to redefine education at this stage. So
Right.
I like what you said too about your guys' ego, because it's very true. Like when we see you guys at trade shows, everybody that I've interacted with at a company has been like super friendly, outgoing. Mm-hmm. It's very welcoming type company, willing to like share whatever information you have and stuff, and you're very customer centric. You don't have that like kind of stuck up vibe that you can see from time to time and in other sectors of healthcare.
Yeah.
And it's really nice, like dealing with a company like yours.
Oh yeah, it's been a pleasure from the beginning.
It has. We really appreciate all of the support you've provided for our company. It's definitely, without your support, we would not be able to provide the level of education that we do, and the hands-on skills training, which is, vital to the learner's ability to go back and, immediately integrate the skills learned into clinical practice. So we certainly appreciate your support. And I think you did an amazing job of summarizing all the benefits of your system and features, and how you're really kind of in a class of your own as far as, identifying as a handheld and giving you the features of higher end systems as well. So I think that's important for our learners to know and to realize that when they're out looking for a system, even if they're thinking of it, I just need a handheld. It's more than just needing a handheld system. You need a system that's going to provide what you need, the technology you need to best provide the care for your patients. And that's going to be different for every clinician, so they need to do their due diligence to figure out what system is that best for them.
Right.
And so
that's really well said. Yeah. Really well said.
So I think this has been a great discussion with you, Luke, and it's really been fun and informing to hear more about the system, for our learners to hear more about not only just their capabilities in the POCUS world, but also how you've integrated AI to improve efficiency, to help in the training of novice users, helping the efficiency of the more seasoned sonographers and basically to help improve overall patient care. So I think that, the goal of these advancements is really to help physicians and healthcare providers to rapidly diagnose and treat their patients, and that does result with improved patient outcomes. So we really appreciate you joining us here today and sharing all of this exciting information with us.
Yeah.
Yeah, thanks for having me. I really appreciated the conversation. Really fun to talk with you all.
Yeah, it's been a lot of fun, and we look forward to doing it again. And we'd also like to thank all of our listeners. You guys have always just been so great to us and so loyal. So thank you for being with us today. Make sure that you subscribe to the Sonography Lounge podcast. Visit us on social media so that you don't miss a single episode. And we hope that you have a great day and happy scanning.
Thanks for listening to the Sonography Lounge. Don't forget, if you like this episode, please subscribe and leave us a review on iTunes, Spotify, or wherever you get your podcasts. You can also find us on Instagram at Sonography Lounge and Twitter at SonographyLNG. If you have any questions, comments, or topic suggestions, feel free to send an email to us at sonographylounge@gmail.com. Have a great week and scan, scan, scan.